Hi, Dr. Marcia here with another in my Coping with COVID series. So today I want to talk about anger. I've been, looking at the news, and there's a lot of angry people around these days. And it's understandable. COVID has really changed our world as we know it. There has been a lot of social isolation, a lot of financial difficulties, and in the middle, of course, the Black Lives Matter movement has come up. So many things are happening these days, and people are getting very angry. And what do you do with all that anger, right? You don't want to be taking out your anger on your loved ones. You don't want to be acting out your anger in ways that are going to get you into trouble or create problems around you. So what do you do with your angry feelings? Well, there's a few things that you can do. The first and most important thing you want to do with your anger is just acknowledge that you're feeling angry these days. Maybe you're angry because you can't work. Maybe you're angry because you're in financial difficulties. Maybe you're angry because loved ones have gotten sick or even have passed away. Maybe you're angry because you're just frustrated because you don't know what's going to come next. There's lots of reasons you can be angry. So first thing to do is acknowledge your angry feelings, because when you acknowledge them, that's the beginning of dealing with them. Then you need to understand the difference between feeling a feeling and expressing a feeling. When you feel the feeling, it's inside of you. When you express the feeling, it's something you send outside. So sometimes it's appropriate to just feel the feeling, and sometimes it's appropriate to express the feeling. But when you're expressing your anger, you need to know the difference between appropriate expression of anger and inappropriate expression of anger. So when you're appropriately expressing your anger, it goes like this. Hey, so-and-so, when you did X, I felt angry. Or, hey, so-and-so, when you didn't do X like I asked you to, it made me angry. You don't yell. You don't need to raise your voice. All you need to say is, when you did or didn't do that thing, it made me feel angry. That's how you express anger. That's enough. Using the word angry or anger is enough to indicate to the other person how you were feeling, and then they get a chance to respond. Hopefully they will respond in a respectful and appropriate way. And if you say it that way, then you know that if they respond poorly, it's not because of your delivery. Now, sometimes it's just appropriate to have our feelings inside. So let's say we're at work and our boss does something or a colleague does something and it makes us angry. Maybe that's not the best place to be expressing our angry feelings, and so we can acknowledge internally, boy, that made me feel really angry, but on the outside be very professional, because we don't want to risk losing our job or alienating our colleagues or our boss. And so then maybe we'll go home and we'll talk about it with our partner or with our roommate and say, something happened today that made me really angry. Or we can do other things. We can journal about our feelings. We can write an angry letter to the person who upset us. We don't send them the letter. The letter is not to be delivered. It's just a way for us to vent our feelings. So again, sometimes it's appropriate to keep the angry feelings inside for the moment. Sometimes it's appropriate to communicate those feelings. You always want to communicate them respectfully and politely, and that way you will be guaranteed that if the person has a bad reaction, it's not because of how you delivered your angry feelings, it's because of their own problems with hearing anything having to do with anger. And then again, on your own, very constructive ways of expressing your anger: writing, art, dancing, shouting, singing, bouncing around, as long as no one gets hurt, including yourself. Another way to deal with your angry feelings is to think about some reasons why you might be getting angry. For example, somebody in my practice had an alcoholic father, and this father was always getting drunk, and then he was behaving badly. And then the other day, someone around her got drunk and was behaving badly, and she got extremely angry. And she realized with our conversation that the reason she got so angry was because it reminded her of a very painful experience from her past. So sometimes things trigger our anger today because they are related to things that happened in the past. And so in that way, we can look at the situation, recognize what's going on around an old hurt, and process that hurt. If you're in psychotherapy, you can process it with your therapist. And if you're not in therapy, you can talk with anyone really who's understanding and sympathetic, or you can journal about it or do art about it or writing about it, so that you can help to sort out those feelings about something that got triggered from your past hurtful experiences. So I'm hoping that all of these thoughts about how to cope with anger will help you as you cope with COVID for the days to come. And please stay tuned for more videos. Stay safe, keep your hearts open, and we'll be talking to you soon.